Hello everyone, I'm Dr. Meera Raghavan, a senior consultant urogynecologist and robotic surgeon. I consult at Apollo OMR Perungudi as well as at Apollo Hospitals Greaves Lane. We will be now evaluating the most important problem of bedwetting, which happens in children, young adults and elderly women. Now, bedwetting, which is also scientifically termed as nocturnal enuresis, is not so an uncommon problem, especially in children, young teenagers and elderly women as well. Why does this happen? Usually it happens because of an underlying bladder which is overactive in its own merit, which causes sudden release of urine when the patient especially is in deep sleep. Many of the time these women say that they have been dreaming that they have been in the washroom and thereby not able to control the urination and have a bedwetting episode. Children who suffer from bedwetting do have certain other reasons why they have this particular problem. Irregular drinking habits, especially excess intake of caffeinated soft aerated drinks, caffeine and tea, and improper toilet training habits usually are a precursor for such bladder related bedwetting issues. Children also can suffer from worm infestation, which can cause bedwetting in them. Bullying, psychological trauma, sexual abuse and childhood abuse could be the underlying psychological issues why such children could suffer from bedwetting. Usually they come off these problems by the age of 12 to 14. However, if they continue to do so, we need to investigate further. We have had a case where a multidisciplinary team had been involved when a 15-year-old continued to have 3 to 4 episodes of bedwetting in a day, and we found that she was actually suffering from absence seizures by a neurologist who then treated her for that, and she stopped having such bedwetting episodes. In the elderly, bedwetting happens due to completely different causes. Mainly, an innocuous symptom such as snoring could be the underlying problem why elderly women have nocturnal enuresis or bedwetting. Let us see how these two are interrelated. If somebody is snoring, the tongue falls back, and when the tongue falls back, there is not enough oxygen supplied to the brain. This completely takes off the inhibition of the brain over the bladder and they lose control on the bladder. So, snoring, though being a very innocent symptom or something which can be ignored by many people, could mean that the brain is not receiving enough oxygen, and in the long run, cumulative absence of oxygen during deep sleep every day for a long period of time can be a harbinger for stroke or multiple problems in the brain. So, bedwetting and snoring are symptoms which should not be ignored and could mean that the brain is not receiving enough oxygen.